Next, we will have Lukasz talk to us about the cost of adult diets in relation to their healthiness and environmental sustainability, an analysis of the 2011-2012 Indian National Sample Survey. Lukasz.
Hello, I am Lukasz Aleksandrawicz. I'm affiliated with the London School of Hygiene and Tropical Medicine, where I just finished my PhD, as well as the LCR, the Lee Rahim Center for Integrative Research on Agriculture and Health, which very generously funded my PhD. And I'm presenting on behalf of my co-authors at LSHTM. And I'll be talking about a recent analysis we did on the cost of eating healthy and sustainable diets in India. So the context for this work is very similar to Marco's presentation, which he nicely laid out. We know that food production and the diets we choose to eat are major drivers of environmental change globally. So for example, about a quarter of all greenhouse gas emissions, about a third of all ice-free land, and over 70% of water extracted globally is used in the production of food. And of course, diets are also the leading risk factor for the global burden of disease. So an emerging body of work has shown that actually shifting average diets, mostly in high countries, from the unsustainable and unhealthy ones that they currently are, to more sustainable dietary patterns can bring about environmental and health benefits. However, less is known about the affordability of these sustainable diets. And of course, price is a major driver of what we choose to eat. And few studies have looked at this. Most of them have looked at affordability in high-income countries, and the results have been mixed, both that sustainable diets can be cheaper in some instances, but also more expensive in other cases. And generally, very little of this work has been done in low and middle-income countries. But actually, sustainable diets and affordability are quite relevant to the Indian context. For one, as many of you will be familiar with, India is faced with a very complex nutritional context. And additionally, there's also environmental implications here as well. So moving forward, the population's growing, India needs to produce more food and higher quality food, more calories, but also more nutritious and diverse diets. And currently, many areas in India are facing water stress. There's a lack of agricultural land for expansion, for increased production. And of course, India has also ratified the Paris Climate Agreement, so it needs to stabilize its greenhouse gas emissions. And we recently looked at sustainable diets in India, and this builds on this work, showing that actually if the current nutritional context and current individuals in India were moved to healthy diets, which followed healthy dietary guidelines, the resulting environmental footprints from the food system would actually increase a little bit. But there was an opportunity among those who currently eat adequate nutritional or adequate dietary energy or overconsume. If they shifted to healthier and sustainable diets, you could actually reduce environmental footprints. So this analysis is looking at the latter case, is looking at observed diets and the cost of those in relation to their health and sustainability. So we essentially asked the question, what is the cost in rupees per person per day for eating different types of healthy and sustainable diets? And the starting point was the National Sample Survey, the latest round, which is available to us from 2011 and 12. Which is a nationally representative household and consumer expenditure survey, which asked households about the amount of food they purchased, which is a proxy for intake, as well as the value and cost of that food. And from this, that's a household level survey, we estimated individual level intakes for adults in households based on a simple assumption of using dietary energy requirements based on age and sex. And to the dietary data, we matched environmental footprints from greenhouse gas emissions taken from a project called the Cool Farm Tool, land use footprints taken from the FAO, and water use taken from a data set provided by the Water Footprint Network. And all of these data have been previously published and are openly available. And then we stratified individuals into different dietary categories based on the diets that they are estimated to consume. So our reference diet was an adequate diet. So essentially taking those people that consume adequate dietary energy or above, but who do not meet healthy guidelines. We also had a healthy diet, which adhered to Indian National Dietary Guidelines on dietary energy, on proportion of calories from fat and protein, and on sufficient fruit and veg intake. And because almost nobody adheres to dietary guidelines, we also had a slightly more loose category called relatively healthy diets. And the only difference here was that we allowed basically 3 servings of fruit and veg as opposed to the 5 servings of fruit and veg in the full healthy guidelines. And we also looked at lower footprint versions of these healthy diets. And this was just a relative binary measure, basically looking at if someone's dietary footprints were lower than average footprints within a specific demographic grouping that they belong to. And we tested these for differences in costs of these diets using mixed effects models and using the household as the random effect in that. So looking at just a description of the population, looking at the top row for all India, about 16% of the adults we observed in the NSS followed a relatively healthy diet. And far fewer, only 2%, followed the full healthy NIN nutritional guidelines. And then when we assessed those which followed relatively healthy or healthy diets and also had lower footprints, that dropped even further to 6% and 1%. When we looked at the environmental footprints of these different dietary categories, it was interesting to note that actually the 2 healthy guidelines, the relatively healthy diet and the healthy diet, had slightly higher environmental footprints than just an adequate diet, which had enough dietary energy, but was not healthy in itself. And this was largely to do with actually slightly more dairy intake and slightly more meat intake in the healthy guidelines. And then, of course, the lower footprint diets had lower environmental footprints, but the savings were actually quite modest. You got quite few environmental benefits, although there were still some compared to an adequate diet. And then looking at the costs, so overall we found that healthy diets and healthy and environmentally sustainable diets were more expensive than an adequate diet in India. I show the mean costs and also the regression coefficients. So very quickly, healthy diets, a relatively healthy diet was about 1% higher in price than just an adequate diet, and a full healthy diet was about 8% higher in cost than just an adequate diet. When we looked at healthy diets that were also lower in environmental footprints, the costs reduced a little bit, but they were still more expensive than an adequate diet. So about 1% more for a relatively healthy diet with lower footprints, and about 5% more for a healthy diet with lower footprints. And that was at the national level, which of course obscures a lot of the complexity and kind of interesting contexts around India. When we looked at this through wealth quartiles, this is MPCE, the mean per capita, the monthly per capita expenditure, we saw that households or adults in the lowest wealth quartile had much higher costs to reach a healthy diet compared to the cost of an adequate diet for them. But actually, contrary to that, for the richest households, a healthy and lower footprint diet was actually cheaper. And a similar situation was seen when we looked at rural households and urban households, where for rural residents, healthy and low footprint diets were more expensive, but for urban residents, they were slightly cheaper. And then we also looked at which food groups contribute most to the higher cost of healthy and low footprint diets. And looking at this by the different food groups, it was fruit and vegetables which contributed most as an aggregate, as well as dairy to the higher cost of a healthy and sustainable diet. So in summary, the affordability of healthy and sustainable diets at a national level, they are slightly more expensive, but this does vary quite a bit depending on which subpopulation or subnational population is being looked at. And we did find an opportunity for the wealthiest households and those living in urban areas. We saw the case that actually healthy and sustainable diets could be slightly more affordable than just the average current diets they consume. And fruit and vegetables and dairy were the food groups that contributed most to the higher cost of healthy and sustainable diets. Thank you.